Good afternoon. It's Monday, the 26th of July, 2021, just after 1 o'clock. Welcome to UK Column News. Your host today, Mike Robinson, myself, Brian Gerrish, and we're delighted to be joined by David Scott, bringing us northern exposure from north of the border.
Well, we're going to get on with cases, first of all, and cases in the United Kingdom are coming down, apparently. Yesterday was the first time cases have fallen below 30,000 since the 6th of July, according to the government. And this is from the government's corona dashboard on screen there. Daily deaths standing at 28 today. That's up 3 from the same time last week. So, Brian, not too much going on, actually. There are lots of cases being talked about, not very many hospitalizations, and not very many deaths. This is the 5th day in a row that cases have come down, as you can see on the graph there, just about on the far right. But this morning on BBC Radio 4, of course, we had to get somebody to talk about this, and it was Dr. Mike Tildesley from SAGE. And he said, the first thing before I start is, it's good news. Let's not shy away from that. And then he started talking about caveats. And so he said, I think what we need to think about, though, is that there have been a change recently, there has been a change recently. And I think the big one is that in a lot of parts of the country, schools have now closed for the summer. So the reason the number of cases is coming down is that schools have closed for the summer. And so because schools have closed for the summer, they're not doing their twice weekly lateral flow tests, and therefore the cases are coming down. And David, if I could just say, welcome to the programme. I'm glad to see that even SAGE is recognising that this entire thing is being driven by testing and nothing else.
Well, I love the phrase, let's not shy away from the good news. It sort of suggests that there's a great reluctance to admit there's any good news. They seem much happier in the nature of doom and gloom. But we're going to be brave, and we're going to look at the fact that there's good news. That's heartening.
But in the meantime, an article has appeared on Principia Scientific saying World Health Organization PCR tests at high CT probably all false positive. Well, I think some of us have been saying that for a very long time.
Yeah, and this brings together elements from stories that have come out really since the turn of the year, as the World Health Organization have been slowly admitting that there are problems with the testing. But Principia Scientific here summarizes the two arguments that completely demolish the claim that we have a public health emergency. Item 1, the cases that have been used to declare the emergency are healthy people without any disease symptoms. And item 2, the definition of a pandemic is based not only on cases, not based on science, and the adoption of this new definition in 2009 was done by elite individuals in an emergency committee without scrutiny of the scientific, medical and general community. Scientific definition requires the scrutiny of the community, otherwise it is invalid under the scientific method. So they're pointing to essentially a conspiracy to change the definition of a pandemic by changing the definition of a case. And then they go on to say the World Health Organization admitted, this is some months ago, that any PCR test above 35 cycles is potentially 100% false positive. And then they question exactly what is happening in places like Australia, where the PCR test is running at a rate of 40 to 45. And most cases are people without symptoms. And we know that there's huge panic in Australia, vast government shutdown of society, and almost nobody, I think they've had one death in the last year, in 2021. Almost no one is seriously unwell. So it is very strange. And they're asking exactly what is going on, what cycles, what thresholds are in fact being used in Australia, and they're pointing out the lack of transparency. And they conclude the cases, the disease of the disease in the media is presenting healthy people who have a PCR test but have no symptoms. It is these cases in healthy people that have been used to close borders and quarantine healthy people in Australia. So this is a good summary of exactly how you generate a pandemic, a worldwide scare, a worldwide shutdown, without there being anything actually, scientific, any real hard evidence to justify anything like this level of response.
So that brings us on then to the Centers for Disease Control, and this is doing the rounds at the moment, and many people are actually misinterpreting this release from the CDC because it says lab alert changes to CDC RT-PCR for SARS-CoV-2 testing, and it says that basically after December the 31st, 2021, the CDC will withdraw. Let's just zoom in on this a little bit. CDC will withdraw the request to the US Food and Drug Administration for emergency use authorization of the CDC 2019 novel coronavirus real-time PCR diagnostic panel, the assay first introduced in February 2020 for detection of SARS-CoV-2 only. But here's the thing. It goes on to say CDC is providing this advance notice for clinical laboratories to have adequate time to select and implement one of the many FDA authorized alternatives. So people have interpreted this to mean that the CDC is effectively getting rid of PCR on the 31st of December, but this is not the case, because if we read on, it says in preparation for this change, CDC recommends clinical laboratories and testing sites that have been using the CDC 2019 RT-PCR assay select and begin their transition to another FDA authorized COVID-19 test. CDC encourages laboratories to consider adoption of a multiplexed method that can facilitate detection and differentiation of SARS-CoV-2 and influenza viruses. That's what this is about. This is not about getting rid of PCR. It's actually about expanding the use of PCR, routine PCR testing, to not only include COVID-19, but also to include influenza A and B. So let's have a look at